Welcome to this week's NIB News Update.
The National Insurance Board last week continued its series of public meetings on the National Prescription Drug Plan. At a meeting held in South New Providence, Dr. Stanley Lalta, project manager for the drug plan, said the plan is reducing costs and increasing access to necessary prescription drugs for persons with 11 chronic conditions.
The drug plan tries to make a difference. The drug plan wants to make a change and to assist persons suffering with chronic diseases to better manage their condition by having better access to your prescription medication, by reducing the cost of that medication, and by ensuring that you can have a full supply of your medication whenever it is needed so you can better manage your condition. We realized in the past that many persons had difficulties getting their medication from the public clinics or the hospital. We realized that many persons, when they go to the private pharmacies, sometimes you have to balance, should I buy the drugs or should I buy food? Sometimes you have to work out, how far can I stretch this medication beyond 1 month? Sometimes you want to see how often you can break the tablet. Sometimes some people miss a day or 2 days because they want to see how far the medication can carry them. All of these are matters which we recognize cause problems to persons with chronic disease. And so the drug plan is designed to help persons to make sure they get their medication in the right quantity, at the right time, and at no cost to you in this first phase of the plan.
According to Dr. Lalta, the plan enables beneficiaries to obtain a monthly maximum of formulary prescription drugs from a wide choice of private and public pharmacies.
In the drug plan, you can get your full supply every month. You don't have to worry about stocking up. And so we have determined what is the quantity that you will need per month. Some persons it is 30 tablets, some persons it is 60, some persons it is 120. We asked the specialists how much do they think a person should be taking for their condition per month, and this is what they gave us. So we have up to the maximum that they think you should be taking for your condition.
Dr. Lalta also said the drug plan will focus on promoting healthy lifestyles.
Chronic diseases have their roots in how we live, in what we eat, in how much we exercise, in our lifestyle. And therefore we recognize that we have to pay more attention to healthy living, to health promotion. And so another component, another aspect of the plan is not just to provide access to drugs to treat the condition, but how do we try to prevent it in the first place? So to prevent another generation of Bahamians from coming down with the same conditions. And so we have a second part of the plan that we call our Healthy People program, which will enable us to provide money, to provide the funds to support organizations in health, organizations in churches, in the communities, who may have a very good project or a very good idea how to promote health, how to reduce illness. And we will provide the funds to support you in that project or that program, because we don't only want to treat the problem, we want to prevent the problem as much as possible.
Persons attending the meeting were able to ask questions about the drug plan. Others commented on what they heard.
I learned about, they explained the health plan much more than I know about it, and they asking you to come forward with anything that you might want to know to encourage you to learn.
They're trying their best to reach out to everybody, you understand? But like I say, in time, the majority of the other people will be fitted in the plan.
For more information on the National Prescription Drug Plan, visit nibdrugplan.com or call 356-2070.